Polio is a devastating viral infection that was rampant in the US in the 1950s and can affect the skeleton. Hi, my name is Paige. I have a master's in forensic anthropology. Let's look at how this disease affects the bones. Here at the Bone Museum, we have this femur of someone who had polio. So let's take a look at how this disease changed the morphology of the bone. Paralytic polio affected less than 1% of people who contracted polio, and it caused paralysis in either one or more limbs. This caused the muscle to not develop as it would, resulting in much smaller and more gracile bones. Normal bone development is stimulated by activities such as weight bearing and resistance and the muscle pulling on these bones. When your limb is paralyzed, you're not having these activities on the bone. Thus, they're going to remain underdeveloped, which is what we see with paralytic polio cases. It's important to note that these underdeveloped features of bones in paralytic polio patients are only going to be seen in people who contract the disease at a younger age. This is because their bones are not fully developed yet, so they're more affected by the paralysis. Whereas if an adult contracts paralysis, their bones are already mostly developed, so we're not going to see as drastic of a change. There aren't many cases of polio noted in the osteoarchaeological literature. However, a paper in 2024 published by Gomez-Gonzalez et al. Studied the remains of an 82-year-old individual who is known to have contracted paralytic polio at the age of 5. Let's take a look at some of the features that they identified in their remains and compare it to our femur here at the Bone Museum. Overall, we have a smaller bone both in length and diameter. We also have an anteversion of the left proximal femur, meaning at the hip joint it was rotating inward. Of note in the paper, they also exhibited a coxavalga, which is a greater angle between the head and neck of the femur and the shaft. We don't see that here, however, it would have been common because you don't have the weight pushing down that angle as you do in normal development. They also noted torsion of the tibia, meaning that the shaft was twisted. The left foot bones were also smaller and they were curved inward, which is referred to as clubfoot, and there was cortical thinning and low bone density. Of note, we also have a lack of enthesial changes in the polio-affected limb. The entheses are where you're going to have your ligaments and tendons inserting into the bone, and they pull on it in normal development, creating raised areas, as you can see here on our normal femur. Other effects you can see throughout the skeleton would include scoliosis, osteoarthritis, osteoporosis, as well as an asymmetrical pelvis, and these are all going to be accounting for the imbalances caused by the paralytic limb. So just to summarize, people who contract paralytic polio at a young age are going to have smaller, more gracile bones in the paralyzed limb, as well as other skeletal changes to compensate for this imbalance. So that's a little bit more about polio. Here at the Bone Museum, it's our mission to make the study of osteology more accessible. If you like this video, like and follow for more.